Namaskar, hello, and a very warm welcome to CIET NCRT's live phone and interactive program. Here we are with our special series of Paricharcha with our, of course, esteemed panel members. My name is Tanvi Khurana, and at this moment you're watching us on PME Vidya channel number 6 and also on channel number 11. Well, as you all know that today is Friday and we come here on this platform discussing one new topic every day. Every Friday, I mean. So today is Friday and let me tell you our today's topic, which is Catch Them Young, importance of starting early for mental health promotion. If you have any questions, any queries regarding this topic, then please share them with us. You're watching us on our YouTube channel, that is NCERT Official. In the live chat box, you can write down your questions, your queries, and share them with us. And I'm sure our esteemed members, they'll be more than happy to answer all your queries, all your doubts. Till 4 o'clock, our panel members are going to be with us answering your questions, and it is going to be a very fruitful discussion, let me guarantee you that. Let me tell you a little bit about Paricharcha. This is a series on mental well-being and also a live phone and interactive program. And what exactly is Paricharcha? This program is being initiated under MANODARPAN, an initiative by Ministry of Education, Government of India, to provide psychosocial support to the students, to the teachers, as well as their families. Well, and if you want to know more about this particular initiative called MANODARPAN, then you can log in to the website, which is manodarpan.education.gov.in. And there's a national toll-free number through which you can contact us and raise your queries. And the number is 844-844-0632. So there are multiple mediums through which you can connect with us. You can raise your questions regarding the topic, that is Catch Them Young, importance of starting early for mental health promotion. Well, that is just not all. You're also watching us on our Facebook page, that is NCERT, National Council of Educational Research and Training. Now, please let me welcome all the guest members that are with us at this moment, and they'll be talking about this topic. Let me please introduce our first guest, and she is Miss Sony Gill. A very warm welcome to you, ma'am. So, ma'am is a special educator and psychologist from Early Intervention and Faculty Training Courses, Bethany Society, Shillong. And we have with us Mr. Santosh Kumar Ojha. A very warm welcome to you too, sir. So, sir is a PGT in biology and a practicing counsellor from Kendriya Vidyalaya RRL, Jorhat, Assam. Our next guest is Dr. Prachi Ghildyal. A very warm welcome to you too, ma'am, in our program. She is an assistant professor of psychology from Northeastern Regional Institute of Education, that is NEERI, Shillong, NCRT. And along with her, we have one more guest with us, and that is Miss Namita Goswami. Welcome to our program, ma'am. So, ma'am is a former principal from Army Public School, Happy Valley, Shillong. And last but not at all the least, we have with us Dr. Rihunlang Rymbai, and she is an assistant professor from Department of Education from Northeastern Hill University, Shillong. Once again, I would like to welcome all our panel members on this discussion for being a part of our discussion of Paricharcha. So let's begin this discussion, and let me ask Prachi ma'am my first thing, because we would like to understand the topic and we would like to know that what is the outcome of this entire program. So let me ask her, ma'am, what is it that we are going to discuss in this particular program and what is in store for our viewers?
Namaskar to everyone and a very good afternoon. Tanvi, thank you for all the introduction. I would like to begin with a brief introduction to this topic, which we have chosen for today's discussion, Catch 'em Young, the importance of starting early for mental health promotion. We have all been talking mental health and its importance. The World Health Organization is giving a lot of emphasis on mental health promotion. In fact, this whole month is the Mental Health Month, and we just celebrated World Mental Health Day on Monday, the 10th of October. So it is significance right now, but for all these years, the area of mental health has been neglected. We have really not given it the due importance, and that is the reason that at this stage we are having to dedicate days and weeks and months for mental health promotion. The idea is to create awareness about the importance of mental health. It is in keeping with this that we are trying to discuss some issues related to mental health promotion. As you all may be knowing, that World Health Organization says that mental health is not just the absence of illness or disease. Just the fact that you're not sick doesn't mean that you're mentally healthy. So we need to go beyond not being sick when we talk about mental health. So the focus all these years has been on cognitive development, economic development, all kinds of development, but not on not actually no focus. It has really been neglected, but we have failed to realize that this is actually the very foundation of all that a person can do. It's said that without mental health, we cannot really talk about any health. So there's no health without mental health, and a good mental bedrock of a good, happy, contented personality, where a person can really contribute to his society, contribute, realize all his potential, and really do well in life. So that is why we are talking about mental health. We need to know that it is important for us to give a lot of importance to this from the very beginning. It becomes difficult for us to change patterns of thinking, feeling, and behaving once they are entrenched in our personalities. So if we start behaving in a particular way when we are young, we get used to responding to all situations in that particular manner, and at times it may be helpful for us. It may not be very uh, productive for us. It may actually be maladaptive for us. So we are trying to help people very early so that we can arrest this trend of getting into maladaptive, I mean, not some very useful ways of being or behaving. They don't lead us anywhere. So in order to ensure proper emotional and mental development, and to make sure that our young people enjoy good mental health, we need to start really early. And when I say enjoy good mental health, I need to say that we are emphasizing on the word enjoy. So when you possess good mental health, it enables you to be free, make it helps you to make use of your resources. You may be very talented, but if your mental health is not really good, you may not be able to make use to the best possible manner. It helps you to realize your potential and live meaningful and fulfilling lives. So we start early. It's quite like we start early when we have to introduce people to an art, maybe to become a musician, to become a dancer, even for becoming a sports person. We catch them young. We always say we need to catch them young and start training them to learn the right skills that will come in handy to them when they grow up. And similarly, there's another aspect to catching them young. There's something we also call nip it in the bud. So there are some maladaptive patterns of behavior which if we can arrest at a very early stage, we may be able to help children from getting into that pattern when they grow up. So what we are going to do today, we are going to discuss these two aspects of starting early, how we can promote mental health in the child, and how we can also identify some of the factors or some which are like red flags in their development, which are telling us that there might be some risk with the child's development. So we will be talking about these things, and the panel of experts is like, they are working in this area. They have first-hand experience of dealing with children, with teachers and students. So we would be beginning with our discussion with them. And I will begin by asking Ma'am Sony Gill, who is an early intervention specialist. She's working with young children. And I would like to ask her how we can actually identify children who are having problem behavior. So what are some of the signs and symptoms that can tell us that a particular child is vulnerable or might grow up to have some problems? Ma'am, please.
Yeah, good afternoon, everyone. Yeah, just as Ma'am Prachi said, we want to nip things in the bud, right? And as she said, when we think about mental health, generally we are thinking of our overall wellness in how we think, how we regulate our feelings, and how we behave. And when it comes to young children, then we need to look clearly at any delays or disruptions in children developing age-appropriate thinking, behaviors, emotional skills, as well as ways of behaving. Okay, so with young children, we're going to think a lot about delays and disruptions. And disruptions would include things that are abnormal as well. Okay, I don't like to use the word normal and abnormal, but just for the sake of conversation, I will use it now and then today. Okay, so generally, why do we develop mental health issues? Not only children, all of us, like human beings in general. We know that there are physical factors. We know that there is heredity. We know there's a lot to do with brain chemistry. Okay, but we also know there are environmental factors. So we go back forever, we keep going back to our nature versus nurture discussion. But we do know that when we look at these things very early on, and by very early on, I mean even before 1 year of age, we can sometimes start seeing that children do have even mental health issues, not just delays, okay? We know that when we start really early, when we can identify all issues of children, then we know that we can actually treat them, and there are a lot of things that can actually reverse the whole situation in certain conditions, but not all. Okay, and we know that counseling, psychotherapy, play therapy, various other types of art therapy and playing with mud and all sorts of different mediums, other types of therapies like language therapies, how do you express yourself? Next slide, please. When we look at children, we have certain very important considerations, because when we look at teenagers and adults, things, but when we look at children, okay, can you hear me now?
Yes, ma'am.
Okay, so when we look at children, then we need to consider how well a child functions within the home, within the family, at school, with peers, as well as we have to look, it's a very all-pervasive kind of situation that we have to look at before we can make any real diagnosis as such. And if we can go to the slide, which has 3 little pictures and says important considerations. We have other considerations that we need to keep in mind when we look at very young children is that, first of all, we know that this is the age that they're developing and they're changing really fast, especially the first 5-6 years of life. Every few months, we see such changes in their behavior and their ways of thinking. And the first picture there, the little child scolding the other child, shows a lot about how children at this age really need to learn how to interact with others, how to regulate their emotions, how to stand for themselves, how to bargain, how to sometimes give in, how to interact with people of their own age. And know that at certain ages, for example, at 2 years with the terrible twos, we all know that if a child does not have temper tantrums at that age, it means that he or she is not testing out his limits. So we know that then there is something wrong with the child not testing out limits. The child has to gain some autonomy and independence and willfulness at this stage. Otherwise, we know that the child will then have a lot of ego strength issues later on in life. However, if that child does that same behavior at say 5 or 6 years, then we say something's wrong. There's great delay. So we need to keep in mind development and the cognitive or developmental age of the child whenever we are doing any assessment. Another very important thing is that we also know that all children develop at different paces. So we have, at times we are going to see that some children do develop much later, but so why we do intervention programs is so that we can give them that push all the time, because we're monitoring their development. Somebody's lower in some area, we push them up in that area so that they get higher. So these are all the considerations that to keep in mind, which we don't generally have to do with older children or adults. Okay, NIMHANS had come up with one developmental checklist, which is called the Developmental Psychopathology Checklist for Children, or in short form, DPCL, by Dr. Kapoor et al. And this is a brilliant checklist that any counselor or psychologist can use when you get very young children. It's a very good guide. Okay, and it looks at basically 7 main areas that you can find difficulties in. And this covers almost all childhood type of mental health issues, as well as disabilities to a certain extent. So it includes emotional disorders, hyperkinesis or kind of hyperactivity, also lack of attention, different type of psychoses that children might develop, learning disorders, specific learning disorders, that is specially. Sometimes children get some types of hysterias, and a lot of the anxiety issues that children have comes under this cluster. And then we have a whole lot of conduct disorders, very, very, very common, And then, of course, on the other hand, we have childhood autism. So this particular checklist checks these, and I would highly recommend that any psychologist who is working with very young children go through this, with parents, of course. Okay, I just wanted to mention this. So I just wanted to tell you, if we can go to the slide which says autism spectrum disorders. Yeah. So we have here generally children with autism nowadays, in the past 2 years or so, out of all the children who come to our center here, to our early childhood center here, we find that about 70% of the children are showing symptoms and signs of having being within this autistic spectrum. And it's mostly to do with communication and language, understanding social relationships, and using imagination for play. They have very stereotyped types of ways of entertaining themselves. Very often these children also have a lot of very strange behaviors, which we can now attribute definitely to the types of sensory integration problems they have in their bodies. Okay, it's not that they're trying to behave badly or something like that. Okay, to identify child falls under this spectrum, in India we are using 2 very important tools. One is called the INCLEN for children for autistic disorders, autism spectrum disorders. And it follows basically the DSM-4, DSM-5 criteria, okay? And that says yes, autism, or no, not autism. And then we have the ISA, or the Indian, it's an Indian scale for autism. And once we finish that, we can actually see in 6 different areas in which area the child is having the most difficulties, whether it is in social emotional behavior, whether it's just in reciprocity and interacting with people, or whether it's something to do with the cognitive aspect. So all these things come up vastly there, okay? And these two, if sometimes a child comes to me and my first impression is definitely autism, but when you actually do this and you follow the criteria is really important when you make diagnosis, you might find that he doesn't really fall under the spectrum. So then you have to see in which area from the ISA the child needs the most support so that he can grow in his development. The next slide is on attention deficit hyperactivity disorder, which in the cluster comes under hyperkinesis basically. Worked with children even till high school, even till college, knows that there are these children who just can't pay attention or concentrate and can't seem to follow directions. And, you know, very often they are very impulsive and therefore they're very accident prone. However, earlier we used to say these children need medication, but now we know that we have to first try for at least 6 months some behavioral techniques, maybe even some cognitive modification techniques to help them to gradually increase their attention spans and control impulses. And here again, INCLEN has a very good diagnostic tool which you have to use. Okay, the next slide is our most common, which is anxiety disorders. For some strange reason, our very young children are anxious these days. And sometimes they have such a lot of dread that it disrupts their ability to participate in society altogether. You know, and they don't even want to go for parties. They don't want to leave mothers in playgrounds. They become really clingy. And the most common ones, they don't want to be separated from parents. There's a lot of sibling rivalry. They may decide that they will not speak in a social situation. They might not make eye contact, and therefore sometimes people think, hey, they may be autistic. But no, it could just be that I don't want to interact with you, because I'm so worried that you'll judge me in some way. There are phobias, of course. Children often have a lot of phobias. And sometimes children have this thing of selective or elective mutism. They choose to stop communicating in social situations, and this is caused by anxiety. But ma'am was saying, once they get into the pattern that they might have chosen to stop talking, once it becomes a habit, they may actually not be able to speak when they need to speak again, and maybe even want to speak again. And therefore, it is really important to diagnose this early enough and start your work today. Often we find that children start having a lot of regressive behaviors. They restart bedwetting, they start biting their nails, they start being very clingy with a certain parent or an adult. Sometimes there's a lot of nightmares and scary things like that for children. And of course, children can also have PTSD, which adults have. So I'm not going to go into detail about that because I think you all know about PTSD. Causes a lot of distress and disruption in children. You know, I've met children who were up to, who were even 12 years or 13 years, so almost teenagers, who would suddenly signs where they would become signs of PTSD, hypervigilant and all, and very anxious. Of course, when this happens, their grades go down drastically. They retreat from social situations. They stop enjoying what they used to enjoy. And very often when we dig deep there, we start seeing, yes, they had some really serious trauma when they were young, including child sexual abuse and all, but it needs to be nipped there and then. Okay, can we please move to the slide which has disruptive behavior disorders? Here, children, we all know, we call them naughty children who are defying authority. Okay, that's another 2 slides ahead, please. Often they even resort to aggressive behaviors and start bullying other children. Okay. Another thing we see very, very commonly, and you can begin to see it as early as 2 to 3 years at times. At times it's hard to give a diagnosis of a specific learning disorder because they are not yet into literacy, say, but very often at about 2 years, we can start seeing how they're having a very disorganized in how they put on their clothes, left, right, laterality and things like that. And then we kind of predict that maybe when they're older, they'll have a lot of problems learning how to read or write, specifically print issues, or they might have a lot of issues in how are they going in praxis, dyspraxia, how are they going to decide how to plan and execute a series of actions that can lead to a larger action, which is a lot to do with school learning, a lot to do with sports, a lot to do with somebody throwing a ball and you're learning to catch it at the right time, receipt, propulsion, all that kind of thing included, okay? And here, mostly it is problems of storing, retrieving, and using anything to do that you have, any information that you have processed in your brain. Few minutes, as a few months, we can begin to see children having things like, like failure to thrive. Their sleep patterns, even when they are a few months old, very disrupted sleep patterns. Refusing to get enough nutrition, whether they're breastfeeding or whether it's bottle or whether it's weaning stages, but they're not eating enough. They're very cranky. They are listless. This is one condition called failure to thrive, which is now being seen as one of the first instances, the first types of severe depression in the human, the whole human lifespan. Okay, and connected with does not die of malnutrition and other physiological issues at this stage. This leads later on very, very chronic depression and maybe sometimes more serious mental illness in later life. Okay, if we can go to the slide on eating disorders. And here again, when we think about eating disorders, the kind is anorexia nervosa, bulimia, overeating, compensation eating, etc. However, we have seen that sometimes children, even when they're toddlers, they start having eating disorders. So mostly it is something to do with their self-image. Mostly, 99%, it is something to do with their self-image. And if it is at a later age, it is to do with your body image, of course. And there's also been shown to be a very high relationship between abuse of children and eating disorders later on in life. And here we have a picture of a young girl who is starving herself, another young girl who's totally overeating, and that younger, the one on the lower picture could be as young as 7 or 8, but looks like a teenager. And then we have in very young children, which is called pica or pica, which is eating and ingesting non-edible things. And here we have a picture of a child who's trying to swallow a frog. And these are disorders that you see in children also. Not pica, you don't see that often, but the other two a lot nowadays. Both starving yourself and overeating. And the next slide talks about the opposite, elimination disorders. One was taking food in, one is excretion. And you have enuresis where children, after they have been toilet trained, the next slide, please. After they have been toilet trained, they might regularly wet their bed. And it's not because of a physiological reason, okay? It's not because of any control or sphincter issues or anything like that. And you, which is the same thing, but not with urine, but with feces. And very often children even start ingesting their waste material. So I have sometimes seen this happen even in young adults. So if we don't stop it when they're really young, we're going to have very serious issues by the time they're teenagers and young adults. And the next slide talks about what every one of us knows, mood disorders. Can we go to the next slide, please? And these disorders, of course, we all know they involve a lot of very persistent changes in mood, which have to last for at least a period of 2-3 weeks for us to call it a disorder. It shouldn't be just feeling unhappy or happy or sad or very excited at a certain time. It could be very rapidly changing moods. And sometimes children, when children are very young, yes, their emotions are intense and short-lived. But gradually, as they grow older, we start seeing that they are able to maintain for a while, you know, which is a good mood for a while or a bad mood for a while. They're not so easily distracted in and out of their bad moods as they were earlier. Okay, but gradually we might start seeing that children are very emotionally labile at an age where they should not be. You know, say by 6-7 years. By then they should have learned how to regulate their moods really well. And sometimes we start seeing even bipolar issues among very young children. You know, and sometimes it's so difficult as a clinician when you're looking and working with a child, you say, are these changing moods so much because of something like autism or because of maybe their hyperactivity or something like that? Or is there actually some anxiety? Is there actually a mood issue which needs to actually be checked by a psychiatrist as well? Maybe the child needs medication. So sometimes with children, it's very, very useful to get opinions from other people as well, other professionals, when they're very young. Of course, I always have an issue where I say that I never want a child to send a child for medication unless I have a serious doubt that they do need it, okay? And then next one is the much more serious ones, which is the current slide. Children also have schizophrenia. And earlier, people were very confused between, is it childhood autism or is it schizophrenia? But now there are ways to check it out. Okay, so of course, there are very good guidelines and there are very good checklists and a clinician's eye, which can tell you the difference. And what is so important here is that a child with autism 99% of the time does not require medication, whereas a child with schizophrenia 100% of the time requires medication. Therefore, it is so important to get a correct diagnosis early on. And then we also have tic disorders, which can be sudden impulsive movements or sometimes even saying an utterance. Okay? And this scariest one, which is substance abuse and addiction. I have seen children as young as 3 who start getting addicted to different things, different substances. Very often it is accidental, but we need to make sure that, it could lead to death. There are a lot of very good kinds of programs out there, how to make sure that when children are young, we all know that street children, other children, especially with children from deprived backgrounds, begin to sniff dendrite. They begin to start experimenting with alcohol, especially if that is there in the house. very young children, as young as 5 and 6. So please be careful, but we know that there are lots of programs. The psychologists can help you with this. And although substance does not include devices, I have to mention it here right now, because we are finding, and it has been proven, that children's neural networks are actually changing for the worse because of excessive use of the device when they're really young. I know children who before they're 1 year old can totally scroll and look at things, even find sites before they can read. You know, so please, what I'm trying to say here is please try to watch out. These are issues that need our absolute vigilance. I'd like to stop here for now because I know my time is run out.
Thank you very much, ma'am, for a very, very in-depth exposition on the kinds of problems that children may manifest. And I'm sure we can watch out for those indicators. I would now like Santosh Kumar Ojha ji for letting us know what is it that the school teachers and parents can do to promote mental health, because a lot of problems can be seen in the school setting. So teachers and parents are a very good source for supporting mental health promotion. So Santosh ji, please आप बताएंगे कुछ?
Thank you, Prachi ma'am. After a wonderful deliberation from Sony ma'am, Sony ma'am has told all the problems related to mental health. So I'm here to discuss some of the strategies by which we can support mental health among students. Dear viewers, you all know that a student's social and emotional welfare is important for academic success. And schools are responsible for teaching academics and also for promoting the mental health of students. School mental health services promote the psychological health of all students, providing protective support to students at risk and supporting educational environments that allow students to cope with challenges and problems. Mental health is not only the absence of psychological or behavior problem, but the presence of wellness or psychological health. For example, self-esteem, self-acceptance, resiliency, and effective coping skills contribute to mental health and good behavior in students. And we all know that present-day school-going children are future of our country. While families provide the primary support for developing children's mental health, schools play an important role working with students and families. So let us discuss some of the strategies by which mental health can be promoted. The first one is create a positive school environment. Because when a child is coming to school, and if the child is surrounded by a positive aura, definitely child will be mentally well. In order to promote children mental health, it is necessary for teachers and other educators to implement a variety of strategies in school. Some of are listed here. The first is multiple grade recess, because many things we learn from our peer, many things we learn, I mean to say students, many things they learn from their seniors. Then cross grade lunchtime buddies, then cross grade book clubs, then cross age tutoring. A child who is studying in class 10 may be allowed to teach a student of class 8, because the child will understand the problem of a standard 8 student in a better way. Then the physical environment. The physical environment should promote a sense of learning. For example, collaboratively create and post school-wide expectation and consequences. Display student work throughout the school. For this, we should organize frequent parent-teacher meeting. Keep the school building clean and welcoming, because in the very beginning I have told you that when a child come to school, if the child is surrounded by positive aura, then definitely the child's learning will be promoted, as well as the mental health of the child will also be fine. Then students engagement, we know that students, they have lots of energy. It's the duty of teachers or educators who are at school to channelize their energy in creative pursuit. It is our responsibility. Many times we have seen that when a teacher is not there in the class, children, they used to shout at the top of their voice. Why? Because they have a lot of energy and nobody is there to channelize their energy in creative pursuit. And moreover, school going children, they love their physical and health education period. If in any one day game period is there, majority of them will present in the school, because these are the things which we are experiencing every day. So students engagement is very, very important. So how we can engage our students? Creating classroom environment that increase students engagement is very critical. And while engaging a student, we should focus that a child who is at the top and the child who is at the tip, all must be included, because there should not be any disparity or there should not be any discrimination, because in school we will have children of different family background, different you can say their level of understanding, their cognitive domains will be different. But what, as a teacher, as an educator, we have to plan a strategy which suits for all. At least when a child has given 40 minutes time to us, then child should feel that in this 40 minutes, I have learned something. So we can give them tasks which are challenging, because children, they love challenges. We can also assign them tasks which match their ability. Next, we should give assignments which enhance their self-efficiency. These are the ways, because as a teacher or as an educator, we have to give them power to empower them. Once we empower them, our duty is over. We should give them such assignments, because engaging a student is very important. We should give them such assignments which are relevant to their lives and experience, and also those assignments which are under their control. Now coming next, having inputs in determining rules, schedules, and course content facilitates this perception of control. These factors cultivate feelings of belonging and are associated with a more positive school climate, better academic achievement, and increased student and teacher mental health. Next important part which a school can do is relationship development. We have factors which are contributing for a healthy context for learning. They are positive teacher-student relationship, supportive peer relationship, positive home-school communication. Because you see, uh, children, they spend their 1/3 time at school, because normally schools, they run for around 6 hours or 6 hours 10 minutes. And if you calculate the time to commute to school and go back to home, so it will be around 8 hours. So 1/3 of their time, their valuable time, they are giving to school. As a teacher, it is our responsibility to make that 8 hour time very much fruitful. And within this 8 hour time, we should give them all the things which are necessary to keep them mentally fit. The responsive classroom approach is important, and it promotes school connectedness through relationship development and the discussion of shared content. Now, we have to involve family too. Family involvement is also very important. Family involvement is important in any mental health program for school, because what child is doing at home, what is the behavior of child at home, because children, they are comparatively more comfortable and they open up to a greater extent at their home. So their entire behavior, if it can be studied, because our today's topic for discussion is looking early for mental health problems, and we know that a stitch at time saves nine. These early signs which we get from their parent, these can be a very, you can say, important diagnostic tool to detect any mental health problem which might be cropping in that particular learner or in that particular student. Now, family involvement is important. I told you that the positive attitudes towards learning in school program has numerous strategies for engaging and supporting families by providing opportunity to families for academic and behavioral growth. Social support, because you know man is a social animal. We are making them to be socially acceptable and economically sound. We always aim to make them Obama and at least not Osama. Numerous opportunities for parent involvement in school, parent support group, home visit. Actually, these all programs in Kendriya Vidyalaya Sangathan we all are doing, and we are trying to build a healthy relationship with the parent and a child. If the child is having problem, because in our school, in each and every KB we have a counselor, and that counselor is there to look after the mental health problems, or you can say any issues which may develop or which may be there among the students, boys as well as girls. Now, supporting students with mental health risks and need, because children, they are, as I told you, that they are very fragile and they are to be handled with utmost care. Our one wrong decision or our one wrong statement can change the direction of their thinking. Unfortunately, not all students will be protected by merely attending a school with a positive and engaging school climate, and many may exhibit risk-taking behaviors, because in our school 500 plus children are there, and taking a note of the behavior of 1 to 500 is not humanly possible. Others, there might be certain children, they may not exhibit risk-taking behaviors, and therefore they are not easily identified. It is not uncommon for students to internalize their problem, resulting in stress, anxiety, or depression. Some of the students are they are so much introvert that they will not open up. They will keep their problems within them, and these problems, they know that being an introvert is detrimental for their mental health, but still they will not open up. They may not willingly seek help, in part due to the stigma associated with mental health problems, because in our society, if a student goes to counselor, his friend or her friend will definitely give a level ki lagta hai ye pagal ho gaya. So these taboos or these social means of you can say misconceptions or myths, we have to burst. Stigma is a significant barrier to seeking mental health services in schools, especially in the middle and high school students. School personnel should make a concerted effort to combat the stigma by embedding mental health awareness into the school curriculum itself. Schools can further promote these positive messages and awareness of warning signs to parents and the community through newsletters, flyers, or brochures made by school personnel or students. Now, I would like to conclude because we have other speakers too. On concluding part, I would like to tell that students, they have varying level of needs for mental health support in the school setting. Most students' need will be adequately met in a positive and engaging school environment. However, a supportive school setting will not be sufficient to meet all students' needs. Some will overtly exhibit at-risk behavior or be vulnerable. For these students, it is imperative that educators be aware the warning signs of mental health difficulties and the resources they can call on for consultation and support. Students with intensive mental health care needs a comprehensive system of care involving the home, school, community, society. Hopefully, within this framework of continuum of mental health services, all students will successfully navigate their school experience and beyond. Thank you.
Thank you very much, Santosh ji, and very pertinently mentioned the stigma related to mental health, and which is something which schools can do a lot about, and maybe just let children speak about their problems, their emotions, not like as if they are being sent to a counselor, but just discussing, so that it becomes easy for them to talk about mental health. So that is a very important thing, and of course a lot of other information which will be very important for all our viewers to keep in mind. So now, going deeper into the school system, I would like to ask our next speaker, Madam Namita, to talk about the role of the school as a in ensuring mental health, and not only ensuring but also promoting the mental health of school children, and also if you could throw some light on the difficulties that school personnel face when they are making some kinds of interventions. Namita, ma'am, please.
Thank you, Prachi. My previous speaker, Mr. Ojha, has already given a very elaborate view about the school situation. And can you hear me?
Yes, ma'am, we can hear you.
So about the school situation and all about the, about what can be done in schools. So he's also said that, which is very important, that children spend a major part of their day in school every day. So now mental health awareness is very important there. And actually it has become a part of the curriculum. Schools mandatorily should have a trained counselor. I mean, he's spoken about it, but still, and his counselor guides and helps in breaking down the barriers of learning between the students and the teachers. And the counselor is also a mediator between the teacher, student, and the parents. So, and there are certain programs in school as a counselor takes up, and in the curriculum they have life skill classes where schools take up, on a daily basis, on a daily routine, they have life skill classes. So where they have, they break up into, say, group discussion, a presentation by the students. Then they have, mental health clubs in schools where the teacher is one member and a group of few students. They try to detect, find ways and, speak to each other and go to the counselor and take help and try to solve the problems at the school level. So slowly it happens that, once the relationship grows between the teacher and a particular child or a few students, then automatically the parents also start, depending on the counselor. So hence the parent also try to help and mingle with the counselor and the teacher and be part of the problem. So that helps them a lot in solving the issues at home even. And we also have a concept of special educators in schools now. So that is very important. The special educator is not a counselor. We don't call him or her as a counselor, a special educator who collaborates with the counselor and takes up issues in the school. So the main thing is that children, they make out programs where they have.
Namita ma'am, Namita ma'am, you have unmuted yourself.
So both are, I mean, they are all engaged together, and as a result, they help each other. And so ma'am has also asked me to speak on mainly on the difficulties that the teachers or the school, management, all overall they face in solving these problems. So the main thing is that the children don't share. It's very difficult to make them share their problems. Peers also have a bad influence at times. Though we have peer, we say that peer group counseling is very effective, but at times peers also have a negative influence on the child, saying that you don't open up and they don't report. And then their branding. This branding is one thing which is done in schools, where the teacher brand the child and just name it that this so and so child is having this problem. But the teacher is not the right person to brand it, because it may be a more deeper level problem with the child, which the teacher is not understanding. So that is one main difficulty that happens. And hence the child and the parents also don't like to share their problems with the teachers, so that, parents feel that my child should not be branded. And hence they don't come up with the problem. And another great difficulty is that in a classroom of various children, they don't have, you can't deal with 2-3 children having deeper mental issues. The teacher doesn't understand, and the children also don't cooperate. So, it becomes really difficult in a classroom alone to solve these, mental health issues if they have, for the teachers and the, students also. So as these are small, not small, very important problems which have to be dealt with in a school. So in a school setup, it's not easy to say that, we will do counseling. We are going to have a special educator who's going to solve the child's problem. It's not. So, but then schools are the medium through which parents come to know about the child, because the major part of the, of his day he spends in the school. Then it is further reported to special, say psychiatrists or whatever the problem may be. So that's how they help the child. You detect the person and go to the next level for help. So that is how the schools help. And school is a place where you grow interpersonal relationship. You have between friends, teachers, among other stuff. So that's a very good place to also express your feelings if you are confident that a child is confident that he will not be branded, or if he's not looked down upon with the problem. So it's a sensitive issue for the school teachers also, and the management also, for everybody. But yes, with the help of all the counselors, teachers, parents, and the school management and the special educators, the mental awareness can be given to the children and they can be helped. So, ma'am, I feel this is what I have to say. And one more thing that, we have workshops for teachers for dealing with certain problems. Special speakers come and they have 2-3 days of this also, like workshops there. But still they feel that, they express that they are not fully empowered to give all the help to a child with mental health issues. So this is something we need to do up also. Thank you, ma'am, and I pass on to the next speaker, ma'am, Prachi, ma'am.
Thank you so much, Namita, for some very, very crucial suggestions. Uh, uh, Considering the crucial school teachers play in the promotion of mental health, I would now like to request Dr. Rihunlang to talk about what could we incorporate in teacher training programs and how and the teacher training curriculum so that we can prepare our teachers to provide the support for children in general and also for children who are experiencing difficulties in the area of emotion and behavior. Dr. Rihunlang, please.
Thank you very much, Dr. Prachi. It's a great opportunity to be joining the other panelists to speak on something which is very, very important for the overall well-being of the children in school level, from where they are starting their education. So I would say, looking into whatever the different experts have shared, I feel I should also just go a little bit to understand where teachers stand as people who will help promote mental health of these children. So like the WHO stated, health as being the complete physical, mental, and social well-being, not just merely an absence of disease or infirmity. That is where we must understand that mental health is as important as any other form of health for the children and also for the teachers. So, looking into mental health, we will find that this is not only the issue here. What is more important is that we will go beyond mental health to mental well-being. So if we are looking into the spectrum of mental health, we will see that, in a spectrum where we have at the midpoint or the normal range of being surviving, you would have to the flourishing side or the positive side as thriving and excellence, and to the lower side as struggling and being in crisis. So look into the spectrum, and if we examine ourselves and if we examine our students, we would say we are there in a mode which we would say we are just surviving. We are surviving the everyday issues. We are surviving, if we talk from the point of view of the children, we will say, our children are going or are coming to school being worried, being sad, or they are irritable, or they are distracted or withdrawn. So these are some of the issues which our students are facing on a normal basis. So I would say that if children are facing, of school students at a very, very early age are feeling all these kind of feelings, I believe, I believe, from experience, and I would also speak on behalf of the teachers, that we are not exactly thriving also in our school and in our classroom. We are, in fact, also stressed. So when we talk about, about teachers and students, we are equally facing stress. So if students are facing stress in their own way and teachers are also stressed, then how would we say that teachers can help the students? We must be at a point where we will be able to help our students. We must be as teachers at a point where we will be able to, lend a helping hand, give support to our students, the mental well-being of the students are reached. So if you look like Sir Santosh Kumar also mentioned about the stigma, most people, including children, would want to hide, the mental illness or issues which they are facing because of the stigma. Then, then when we talk about teachers, are we ready? We should say, can teachers work alone? What do we do? So that is why it is of utmost need that we prepare our teachers in such a way that they will be able to handle the situations in the class. And speaking of preparation of teachers, this is not the only important aspect. Talking about teachers, we have so many teachers in place, working in the field every day and dealing with the student stress. So talking about preparation of teachers on how to handle, I would want to talk of 4 different aspects. One, on how the training of the teachers on how we prepare the teachers from the pre-service training to the in-service training to the school initiatives and the teachers' own efforts. So I will be speaking on these 4 points. So because when we look into before I come to that, when we look into the related literature which reported on mental stress and mental health issues, it was found that those schools or researches which had been carried in those schools where counseling is available, where guidance services in the schools are made available, it was found that they have many cases of counseling, especially in the Western world. They have the children are, or the school students are open about their problems, so they they go for counseling. But the I would say the timing when they will get to give maximum counseling is at a time when the students are either having a deadline for their work, or they are facing an examination. So that is a time when you have a full looming of all these counseling classes and sessions taking place in those institutes where counseling is available. So if we look into teacher training, I would first start with policies and programs and funding. So one very, very important aspect, how teachers could help in counseling of the students or could help and support or promote mental health of students, is basically when we start from the very first point. What does the policy say? So if we look into the policies, look into the very most recent one, we're very, very hopeful with this policy. The National Education Policy 2020, it speaks about holistic development. So somewhere we are addressing mental health. So if you look into part 1 and part 2 of the NEP 2020, school education as well as higher education, they have mentioned about the importance of mental health. So it should start from the policy. Then with the policies, when we start making the curriculum framework for the school education as well as for teacher education, here mental health issues and mental health education must find its place. So we are now in the process of making the national curriculum framework for the whole country. So this must be the issue which we should find in that framework later on, when each institution, where each higher education institution or a school board is going to make its curriculum, whether at the school level or at the higher education level in the different universities. So like I said, apart from the policies and the programs, funding must be made available so that it could be helped, so that at some point training of the teachers will happen, and so on and so forth. So this is one aspect. Now, talking about pre-service teacher education program, based on the curriculum which has been framed for the different programs of teacher education, whether it's happening at the elementary level or at the secondary level, or training of the teacher educators and educational administrators at the university level, mental health education must find its place. So as of now, if we examine the curriculum of the universities or of the teacher education institutions like the DICE, which is happening in every district of the country, along as with the cities, we will find that mental health education paper is there to make aware to the teachers how important is mental health, and how they will also later on, when they are absorbed in the school, they will have to play their part. They will have to play their part as people who are promoting the mental health. So when they have an exposure in the curriculum, we see that for these teachers, for these prospective teachers to be able to help the students later on, they learn about mental health education. They are made aware about mental health education, through their curriculum. So if we examine the different curriculum which is existing as of now, you will find that some mental health education papers are in existence as full papers, That will depend, from university to university, as whether it will be a full credit paper or a half credit paper. However, teachers are given exposure to mental health education. Or in some other teacher education program, it might not exist. Mental health education paper might not exist as a full paper, but it could be a part of any educational psychology course. It could come anywhere as a topic of importance in any of the units of the education psychology course for the teachers. So in this way, the theory part of what is mental health education is made exposed to teachers. But apart from the curriculum, and its theory, we also have the co-curricular part where an exposure to these prospective teachers or to the student teachers could be made through the activities, the co-curricular activities, and also the best practices of the teacher education institutions. Now, with the assessment and accreditation of higher education institutions, including the teacher education institutions, this is happening. Different institutions are adopting the best practices, and I feel the best practices which is offered in the field could be very much linked with mental health of the students. Then talking about the curriculum, where one section of the teacher education program should be school internship. Over there, the school internship need not necessarily be only for teaching learning in the classroom, or integration of skills in the classroom, or classroom management, or taking part in the school's assembly. Because in fact, in any teacher education curriculum, there will be a spread of between 12 to 20 weeks of exposure of teachers, of these prospective teachers in the field. Why not? Why not? Teacher education institutions, along with the school, get the teachers trained in the area to have a first-hand experience before they really go to the field and experience about these mental health issues that the students are facing. Why not give them the training during the internship? So that the teachers will be fully equipped, giving them a 360 degree of equipping the student teachers before they are being absorbed into the jobs. So this is what I feel needs to be there in relation to exposing the student teachers to pre-service training. So when we come to the next part, which is the in-service training, many different organizations, the government as well as a non-governmental organization, could do this. So if the NEP 2020 clearly states that all teachers at least every year must have 50 hours of exposure to via the continuous professional development programs. So since the teachers are going also to be the facilitators of mental health in the school, they need to have this exposure through the different trainings, workshops, seminars, conferences, and so on. Especially if they have a training workshop in the field, it will be a very, very effective program for the teachers. So, so when we talk about these continuous professional development programs for teachers, for the in-service teachers, they should be meticulously planned. And the proposals which, the respective people who are going to make the proposal to run such programs must make planned program in relation to how we will touch, mental health, awareness of mental health, the theory and practice. So these teachers, need not only get awareness, but what is more important is that they get the skills to like Madam Goswami was talking about, teachers are not expert to handle, every situation in the school. There is a point where teachers could handle early treatment of first aid mental health. They could give to the students, but what they need to understand is where they are no longer, they no longer have the skill to help the child. So now they will have to also know when is the time or when is the right time to refer the child to an expert, to a clinical psychologist, or to, So we have these different experts where teachers can no longer handle, when it's no longer in the purview of the academics. In maybe exam anxiety, it is normal for everyone to have exam anxiety or deadline anxiety. For children, they might feel a little sad, they may feel a little worried. These are certain things which a teacher could help. But certain issues which Ma'am Sony Gill had spoken about, there were certain things that teachers cannot handle, but at least teacher could facilitate and could give a referral to other experts to handle each case of mental health problem or issue. So then this is what in-service training can do. Now the third part, which I feel is also equally important for teachers, is that the school takes certain initiatives. Because it was found through first-hand experience in research in this particular case, it was found that in one district of, in one block, in one district of Meghalaya, none of the schools have counselors. So no schools had counselors at all. The only thing that they have is that some teachers were sent for training, 3 days training, 4 days training. So how equipped are our teachers? So when we tried to look into the records, no records were found. There was no space for counseling. So they had to use the common space, the classroom for counseling and everything, and a single register to to record all these cases. So that is the condition which we are in. But anyway, we believe that, and we are hopeful that whatever programs are going to happen later, there will be relevant programs in relation to mental health education. They should be relevant. They should be specific programs, and they are programs which teachers could enhance the skill, especially the skill of identifying, like Madam Prachi said in the beginning, to nip in the bud, to understand from the beginning where we are or what kind of problems our students are facing. So here, that is one part which I feel I should share, as a research finding. However, the school could do many things. One, the school, through the school administrator along with the teachers, could organize training workshops, what that particular school needs. So it could be customized. The kind of program that a school needs, they could arrange for that. That is one. Another step which a school can take is that they can invite experts from time to time. With the funding that they have, with the help that they could get, either, if the school is independent, they could do that on their own. But if they need help in funding, maybe funding agencies can help to invite experts, such as, child psychologists, maybe, to help the teachers understand, about the psychology of the child. Like Sir Santosh said, it's not possible to know, the psychological background of every child, if you have 500 students in your school. So this is where at least every teacher, if they get an exposure in the whole school, if everyone gets the exposure through these experts which they invited, then all teachers can work together as a team and help the students in their school. So this is what we have. Then maybe the teachers could have workshops such as mental health first aid programs to identify, the problems that the students are facing. And then, of course, they could also involve, the psychologists along with educationists to help in the learning, because school is where learning should take place, but it should not only, pertain to that. School is where children should be happy. School is where the children should feel safe. School is where, the children, when they grow up, they'll remember that, yes, I went to that school and I had really thoroughly enjoyed learning in that school. So this is what the school can do. Apart from that, maybe they can have lots of materials, whether it's in the library or, subscription to certain programs where they will have maybe video lectures or things like that to enhance the skills of the teachers. But, apart from that, I feel that the schools need to also make the students aware about how serious are mental health issues, because sometimes the students will not open up. And if the teacher goes beyond his or her boundary to help them, then the teacher is an outcast. I don't want to open up to that teacher. So the teacher cannot break that wall, even if the students need very badly the support of the teachers to help them with their mental health. So, this is what the school can do. Make an awareness program that, it's okay. If we face mental health issue, it's okay. we need help. So this is something we can do. And apart from that, the last point which I want to speak here is that the teacher, it depends also on every individual teacher to make their own initiative and effort to help the students and promote the mental health of the students. So the teacher, could have their own routine, could make, mental health a priority, irrespective of the stress that they face, the workload that they have, poor salary sometimes, the salary is really very low, then, very little support sometimes from the colleagues or from the administrator. But even then, a teacher could make his or her own effort to help the students. So there are many ways which I could state, but I feel these are some of the things which the teacher, from their own standpoint, could help in promoting the health to students. Because really, I would conclude here and say that teachers needs to be ready. Teacher needs to support each other, and because they play a very, very important role in promoting the mental health of students. Thank you very much.
Thank you, Dr. Rihunlang, for really telling us about how we can make teachers partners in all our mental health promotion activities. And we are also talking about these days of like teacher as the first level counselor. So we need to really prepare teachers, and having just all teachers need to be sensitized to the issues related to mental health, at least being able to identify problem behavior in children, and also knowing where to go when they identify a child as having some mental or emotional or behavioral problems. So it's not enough to have just one counselor in a school. It doesn't really help, because we need to keep all children under our observation for showing any signs. Or it's not always just showing signs, it's also to promote mental health. It's not that we are going to arrest a problem behavior once we see it. We need to ensure that it doesn't really occur at all. So we need to really make the school environment conducive for the child to grow up mentally healthy. And a lot of factors in the school, including like teacher behavior, how peers relate to the child, all these things are often seen as very critical factors in the child's mental health. So we have very little time. I think we have around 5 minutes, and we need to talk about a very important aspect of this whole discussion, where I would like to request Sony ma'am again to tell us where exactly can the teachers or the parents or the child themselves, the children themselves, turn to for support, for what kind of resources or help is available for children or for even grown-ups who are facing any kind of emotional or behavioral problems.
Yeah, it's let's give a few points, because I think the time is also short. Plus, first of all, I saw in our little poster from MANODARPAN, there's a helpline there itself. Okay. We have in Shillong, we have an early intervention center in Ganesh Das Hospital. And I think most hospitals, the psychiatry section definitely has a clinical psychologist and very often counselors as well, who are trained a lot in child guidance. In Guwahati and in many different places all over the country, in our NIPSIDs have child guidance clinics as well. This morning when I was going through the internet, I found that there are lots of online sites as well. And there are some brilliant questionnaires which even children can fill up themselves, and they're highly confidential. Or for very young children, parents can also fill up if they need to get a first point, and anyone can search those sites. In all states in India, in fact, in each and every district, there is a state medical board or a district medical board, where there are a group of professionals who are supposed to be able to identify children who have various types of issues. Among them, one is mental health issues, okay, as well as other disabilities. and they can get certified and get a disability certificate also. But that is just for the certification aspect, okay? Now for services, I think all these intervention centers and helplines and child guidance clinics, you can go there. In Shillong, there is a group of there is a group of counselors who work also with children called Roots. And in Shillong, if there are any issues, you can always come to Bethany Society and come and meet one of us, and we can always guide you further. But and I think in Shillong we probably have in the north, like apart from Guwahati maybe, in the northeast probably better services or more wide services are there. But in the rest of the country there are far more. You know, I think you just need to be able to try to find them. If you don't know where to go, search the net in your own city. Okay, search the net and find out child guidance clinics. I think child guidance clinics, and especially NIPSID, they're in many, many, many cities all over the country. They're probably the best point that you can, for your first point, then they can refer you or channelize, show you which direction to move in. Yeah, I think that's about it. And if you have nothing else, please search the net. There are amazing, amazing resources there. Whether it is for diagnosis or whether it is for what you can do.
Absolutely. Thank you. Thank you so much, Sony ma'am. And I would like to thank all our panel members for being with us. And all this information you gave regarding the importance of starting early for mental health promotion is actually very, very useful to all our viewers, be it teachers, be it students, and even parents. Because this is not an individual's job. It is a teamwork. And you also said that teachers need to be together and work together for the promotion of mental health. And the early the symptoms gets identified, it's better for the children, of course. Thank you so much once again for being with us. Thank you, ma'am. Thank you, sir. So here we are wrapping up this discussion of Paricharcha. Sid, again, this is Friday, and next Friday we'll come back again on the same platform, which is NCRT Official, at the same time, 2:30 p.m. But the topic will be very different. So keep your questions ready if there are any regarding any topic of mental health that you want to ask. And of course, there's a helpline number as well, which is a national toll-free number, that is 844-844-0632. For any queries, any questions, you can call on this number and raise your questions. Thank you so much. Please take great care of yourself, and thank you once again. Namaskar.